A young woman in her early 20s arrives at the emergency room with severe abdominal pain. The surgical resident on call suspects appendicitis, a routine diagnosis. But something doesn't sit right. The pain is different, located lower in her abdomen. He orders a pelvic exam. His suspicions are confirmed: a ruptured ovarian cyst. Immediate surgery is needed. This is not an isolated event. Gynecological emergencies, often masked by common symptoms, regularly challenge doctors in non-specialist wards. These situations highlight a crucial reality. The human body doesn't adhere to the neat categories of medical specialties. An ovarian cyst doesn't confine its rupture to a gynecologist's office hours. The responsibility often falls on the ER physician, the internist, the surgeon, to decipher the clues and act swiftly. Their ability to recognize these red flags, to look beyond the obvious, can be the difference between a routine admission and a life-altering event. This guide serves as a roadmap for those moments when the lines blur, when a patient's life hangs in the balance, and a gynecological emergency presents itself in the most unexpected of settings. Consider this. A middle-aged woman presents with complaints of persistent abdominal discomfort. Initial thoughts might gravitate towards gastrointestinal issues. However, dismissing it as indigestion or irritable bowel syndrome without a thorough evaluation could have dire consequences. This is where the art of medicine meets the science. A detailed medical history, focusing on menstrual patterns, previous pregnancies, and any history of gynecological conditions, is paramount. Unexplained vaginal bleeding, another common presentation, adds another layer of complexity. While often benign, it could signal a range of conditions, from hormonal imbalances to uterine fibroids or even cancer. The key is to approach each case with a healthy dose of skepticism, ruling out the most serious possibilities first. Then there are the cases of pelvic masses, often silent until they grow large enough to cause discomfort or present as an emergency. Imagine a young athlete rushed to the hospital with excruciating pain. The diagnosis: ovarian torsion, a twisting of the ovary, cutting off its blood supply. What initially seemed like a sports injury turns into a race against time to save the ovary. These scenarios underscore the need for vigilance. We must remain aware of the possibility of gynecological emergencies, even when the initial presentation seems unrelated. A thorough pelvic exam, often perceived as the realm of the gynecologist, becomes an essential tool in the non-specialist setting. It can provide invaluable information, guiding further investigations and ensuring timely intervention. But diagnosis is only half the battle. Equally important is the ability to recognize when a situation demands the expertise of a specialist. Knowing when to consult a gynecologist and having a streamlined process to facilitate that consultation can significantly impact patient outcomes. Early involvement of a gynecologist can be invaluable. They bring their specialized knowledge and skills, enabling more accurate diagnosis and management of complex cases. Timely consultations can be the difference between conservative management and the need for complex surgical interventions. Section 4. The essential tools. Diagnosis in the grey areas. Navigating these situations requires a combination of clinical acumen and access to appropriate diagnostic tools. Ultrasound, for instance, emerges as a cornerstone. A readily available ultrasound in the emergency room can provide real-time images of the pelvic organs, aiding in the diagnosis of conditions like ovarian cysts, ectopic pregnancies, or pelvic inflammatory disease. Furthermore, laboratory tests play a crucial role. A simple, complete blood count can reveal anemia from heavy menstrual bleeding, while a pregnancy test can quickly confirm or rule out a common concern. In more complex cases, a CA-125 test, a tumor marker, can provide insights into the possibility of ovarian cancer. However, technology is only as good as the hands that wield it. It is the physician's ability to interpret these results, to connect the dots between clinical presentation and diagnostic findings, that ultimately leads to an accurate diagnosis and a tailored treatment plan. Section 5. Bridging the divide. The power of collaboration. Ultimately, the successful management of gynecological emergencies in non-specialist wards hinges on collaboration. It necessitates a breaking down of silos between departments, fostering an environment of open communication and mutual respect. Regular interactions between departments through combined rounds, case conferences, and educational sessions can bridge the knowledge gap. Sharing experiences, both successes and challenges, allows for a more comprehensive understanding of these complex cases. By creating a culture of shared responsibility, we empower ourselves to better serve our patients. Every physician, regardless of their specialty, should feel confident and equipped to handle gynecological emergencies. Remember, the patient in the ER with abdominal pain doesn't see themselves as a surgical case or a GN case. They are simply a person in need, and it is our duty as healthcare providers to rise to the challenge, to collaborate, and to provide the best possible care.